Hello, my name is Pablo Golac, and today I will be presenting my final Ben talk as a Benjamin Franklin Scholar here at the University of Pennsylvania on the topic of nursing satisfaction in Chile. Throughout my time at Penn, I've spent a great deal of my academic and extracurricular resources studying the intersections between politics, health policy, and of course the impact that these two things have on the local communities that they affect. Most recently, I traveled to Santiago, Chile with the School of Nursing for a comparative study on the American and Chilean healthcare systems. While in Chile, I set out on a personal inquiry project to learn about nursing satisfaction. With that being said, I'll begin this Ben talk with a brief overview of the current Chilean health indicators, and I'll continue with an outline of my research methodology, and I'll conclude with the presentation of my findings. So, before leaving for Chile, I conducted research on the country's health development indicators and found that Chile's scores compared well with other advanced countries in Europe, Latin America, and North America. To begin, Chile has one of the most highly educated populations in the world, with a greater percentage of the population finishing tertiary education in Chile than in the United States. For nurses, this means having a 5-year bachelor's degree compared to the United States' 4-year degree or 2-year license. And in 2018, the World Health Organization published the World Health Statistics Report and found that Chile's health system consistently ranks well in comparison not only to Latin America, but also the rest of the world. Chile has the 4th lowest maternal mortality ratio in the Americas. Chile has the 4th lowest neonatal mortality rate, the 2nd lowest need for neglected tropical disease intervention, and the 3rd lowest mortality due to non-communicable diseases. Nevertheless, Chile maintains one of the lowest health worker density and distribution ratios, particularly with respect to nursing personnel in the entire world. For context, Chile in this particular indicator scores comparatively with Burkina Faso, Niger, and Somalia. So these impressive statistics relating to health outcomes and these surprisingly low nursing density and distribution ratios led me to hypothesize that either the Chilean nurses and doctors were superhumans, or that my research would find low levels of nurse satisfaction within the country. Upon arrival, Dr. Linda Eichen and Dr. Eileen Lake from the University of Pennsylvania, along with Marta Simonetti, a current PhD student here at Penn, gave a presentation to a group of policymakers, nurses, academics, as well as the Minister of Health for Chile, and outlined the astoundingly low density of nurses in the country, and postulated that it was labor costs for the government, hospitals, private clinics, and care centers that led to this low nursing density ratio. So the cause of Chile's observed variation among other high-performing health systems, that is, a low nursing density ratio, seemed to be simply a financial or budgetary question, according to these pronounced and renowned researchers here at Penn. So what I set out to do in Chile was investigate the effect of this observed variation. I formally and informally interviewed 10 nurses across 5 health centers in Santiago, a public hospital, a private hospital, a geriatric care center, a primary care center, and a private university. I used a variation of the same set of questions relating to the individual nurse's observed nurse-patient ratio, the perceived turnover rate, the perceived differences between the private and public sector, personal experiences relating to career fulfillment and satisfaction, and broader experiences relating to general career fulfillment and satisfaction for those working around the nurses, that is, other nurses that worked with them. The results, like the Chilean health system, were extremely unique. The first finding was that although most nurses were aware of the low nursing density within the country, none of them equated this to low levels of satisfaction among professionals. So for background, the nursing ratios of the nurses that I spoke to ranged from 1 nurse to 8 patients in the best case scenario, and 1 nurse to 25 patients in the worst case scenario. For reference, in the United States, nurse-patient ratios tend to range between 1 in 4 and 1 in 7. However, after speaking with students at the university, I argue that this outcome is probably a result of nurses understanding the intensity of the job from the time they begin their first round of clinicals in college. The second finding was that all the nurses I spoke to perceived that most nurses they worked with would stay or had stayed at the center where they worked for as long as possible or as long as they could. That is, they perceived that their centers had a low turnover rate. While they all claimed this was a sign of satisfaction, many acknowledged that this in part had to do with the lack of available nursing positions in the country. The third finding was the level of each nurse's acceptance and tranquility with the amount of work they undertook on a daily basis. In the ER, 3 nurses would care for around 190 patients a day, yet none of the nurses I spoke to seemed outraged by this fact, which was a very interesting finding for me. And the final finding was that, in general, nurses did not stigmatize work in the public sector, nor were they less satisfied in the public sector when compared to the private sector. I argue that this is because nurses, that there are so few spots for nurses in Chile that in order to avoid unemployment, a nurse will probably just take a job if he or she is offered it rather than wait around for another one, considering the similar levels of pay for the public and private sector in Chile. Following my interviews and analyses of these interviews, I concluded that from the perspective of those still working in the health system, nursing dissatisfaction does not manifest itself in Chile due to a low level of available nursing spots. While Chilean nurses are some of the most educated in the world, lack of labor funding causes many of them to remain unemployed in a country with a shortage of nursing personnel. The budgetary strategy of the most recent governments has been to reduce the number of available beds, at least in the public sector, to relieve the working nurses. Nevertheless, recent access laws have simply shifted patients from the public to private hospital beds. Since many of these people are on public insurance, this strategy ends up being more costly for the government than simply allocating more resources towards labor from the beginning, as private beds are always more expensive than public beds in Chile. Although my data shows that maybe Chilean nurses are simply superhuman, considering they self-reported extremely high levels of satisfaction and also produced successful health indicators. Further interviews with nurses who have exited or have been excluded from the healthcare system would provide a more holistic understanding of the impact of low nursing density ratios to nursing satisfaction. Thank you.